going to do a redo nose job. This patient has already had 2 nasal surgeries, so it's quite hard. I think the earlier surgeon has tried to reconstruct the columella in some fashion.
Her nose is bent and deviated. She doesn't have any tip support.
We are about to start a redo cosmetic nose job. This is the tube patient on the table. You can see the huge improvement that we've got.
मैंने बोला था आपको बहुत सुंदर लगेगा, है ना? आपका चेहरा भी देखो बहुत सुंदर हो गया है. We're going to explain to you a process for this patient that we're going to do a redo nose job. This patient has already had 2 nasal surgeries, one after she had a minor trauma or an accident, and second, cosmetic work. Now I'm going to show you closely in the nose. The major issue is here. So it's quite hard. I think the earlier surgeon has tried to reconstruct the columella in some fashion, and the angle between the lip and the nose is not correct. If you see on this view, you can see that there's like a 2-step there. So we're going to correct that. That's the first thing. Second thing, the tip, there's a grooving here. So it's got a cleft on the tip. So this is going to be corrected. The ala is flared. There's asymmetry. There's very, very broad dorsum asymmetry there, and breathing issue. So we're going to be taking care of all of these concerns in one go. I'm planning a septal reconstruction, septoplasty, rhinoplasty with rib harvest. Patient needs to stay with us for anywhere between 10 to 12 days because there's going to be a lot of extensive bony work, a lot of extensive work on the cartilage, work on the septum, work on the upper lateral cartilage, and also work on the lower lateral cartilage or the alar cartilage. So the nose basically is formed by bones, cartilages, soft tissue. When I say soft tissue, both mucosa and skin. She has a lot of scars. Her first challenge, issues with the bone. Second challenge. The third challenge is earlier surgery. So we have to overcome the problems that the accident has caused on our nose, to overcome the problems the earlier surgeon has done on the nose. And we also have to make her happy at the end of it all, to give a nose that's proportional, that suits her face, and that doesn't have any breathing issues whatsoever. All right, and this is a scan. I will show you one of these scans. You can see the septal issue. There's a lot of bang there. Here there's an earlier fracture. And this is a 3D image. And I'm going to show you an axial cut. She also has other issues with the teeth, which we're not concerned about at this moment in time. So when we have to look at patients that have already had nose jobs done before, either after an accident or just as a cosmetic reason, the scan gives a lot of details. Obviously, also the examination of the nose, apart from seeing the person in direct, we also want to feel the nose, gives the idea about the scars, I'll be able to understand how the earlier surgery is being done, the incisions and everything. So even though we're not able to tell a lot of these inputs to patients who seek online video consultations, when they come over directly, then everything can be explained. And also remember, when we're doing that at redo, when you're looking at a redo, when you're looking at more work that's to be done on a nose that's already been worked upon, and then the recovery is also a wee bit longer than it is for the first time.
So today we have this patient with us who has come to us with a complaint of severe nasal asymmetry. And you can have a look at her nose. Her nose is, look down. Her nose is bent and deviated. She doesn't have any tip support. She had already undergone previous rhinoplasty nose surgery somewhere else in the country, but still did not get any improvement. Still she has a bent nose. Also she having the breathing difficulty from the right side, and her right nostril is blocked. She is also having a septum deviation, because of which she is facing both functional as well as aesthetic problems. So we would be doing the revision rhinoplasty for her. We would be harvesting rib, and we would be correcting her nasal asymmetry and deformity. So now we will be shifting her to the OT.
we're about to start a redo cosmetic nose job. And this patient has already had 2 surgeries earlier and different faster. And now she also has breathing issues. I'm showing in the different views of this nose, how the tip is and how the columnar is, the relation between that and the lid. So this is a patient on whom we've done this 3rd time revision cosmetic nose job. And this is the patient on the table. You can see the huge improvement that we've got. I'm also going to show you the side view where you can see the improvement. That was how she was. Literally no columnar. And now you can see there's a huge improvement. I'm going to show you the basal view. Once again, you can see there's a good improvement. And this is the before view. We're going to show you the facial view one of the time. You can see the scarring, the notching, the problem with the tip. All of that is being corrected. Front view, thighs dorsal acidic line ending on a tip. And you can see here, there was no tip literally. So all of this has been corrected. Patient had a primary 2 surgeries north of this country, once recently and once 3 years ago.
ऐसा नीचे देखना है आपको. अरे सॉरी हो गया. 1 minute. So, and this is a very challenging case. I'm going to show you how it looked. She had 2 rhinoplasties before. Issues with the columnar tip. धीरे से करते हैं, धीरे 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 धीरे. Okay. Yes. अब नहीं दर्द होगा ना, एक बार निकल गया तो फिर दर्द कहाँ से होगा यार. हो गया. बहुत बढ़िया लग रहा है. ठीक है, आप देखो, मैं आपको दिखाता हूँ. 1 मिनट आप रुक जाइए. ऐसा से नीचे देखना आपको. ऐसा धीरे से स्लोली स्लोली करते हैं, स्लोली स्लोली. ठीक है, चलो अब आप देखिए. उधर तो देख ही रहे. मैंने बोला था आपको बहुत सुंदर लगेगा, है ना. आपका चेहरा भी देखो बहुत सुंदर हो गया है. साइड में देखो, ऐसा देखिए आप कितना फ़र्क है. ये नाक तो कोई मतलब ऊपर जा रही थी कहीं, आप देखो कैसा है. ये देखो आपका जो स्कार है कुछ नहीं दिखेगा, अभी पूरा हील हो गया. ये हाँ, क्योंकि ये अभी यहाँ पे हमने ये बैंडेज नहीं लगाया ना, इसके वजह से वहाँ पे स्वेलिंग है. ज़्यादा ऊँचा अच्छा लगेगा आपके लिए, आपके फेस पे बहुत सूट होगा. आपकी जॉ लाइन स्ट्रॉन्ग है, ये स्ट्रॉन्ग है, ये मालार बोन अच्छा है. आपको सब पूछेंगे देखो कि आपका मतलब फेस पे क्या हुआ है. ऐसे देखिए साइड में, देखो कितना फ़र्क है. और ये भी दिखाइए, ऊपर वाला भी देख लेते हैं. आप देखो अभी इसमें भी कितना फ़र्क आ रहा है आपको.